Hey everybody, my name is Brian Hadeed. I'm a general dentist in Clinton Township, Michigan. It's March 31st, 2020. Today I'm going to talk to you about a particular situation. What do you do if you lose a tooth? First of all, don't panic, everybody. We have options nowadays. We have some really nice options for replacing a tooth, or a couple teeth, or a few teeth even. Let's start off with a quick little history lesson. Back 50, 60, 70 years ago, if you were missing a tooth or two teeth or three teeth, one of the more common treatment options for replacing these teeth would have been what's called a removable partial denture. Now, a removable partial denture was and is, we still can do them today, is a metal framework, if you will, with teeth attached to it. Those teeth would be obviously fake teeth made out of, at that time, porcelain, nowadays acrylic. And basically this device would come in and out of your mouth. Now, we can still do those things today. We can still make a removable partial denture today. However, nowadays it's, in my opinion, really being phased out of the dental field in terms of options for replacing a tooth or a few teeth. The problem with this option today is that, first of all, with a removable partial denture, there's always, or very often, there's patients that don't like it. And the reason is because they can, not everybody, but they can cause sore spots. They can be loose. They don't chew very well. They don't perform as well as the patient nowadays expects them to. So very often, a patient isn't so thrilled with a removable partial denture as a tooth replacement option. As well as aesthetics, you can see lots of times the metal clasping, and a lot of patients don't want that anymore. Now, this is not everybody. A lot of patients do have removable partial dentures. There's a lot of patients in my practice that have them, and they love them. They're fine with them. But it's not the number one standard of, not the number one recommended treatment for tooth replacement, at least anymore. Now, 60 years ago, probably the case, or more likely to be way up there. Let's just say that. So let's go to the second tooth replacement option that is available to us today. That is a fixed partial denture. What that entails is, now everybody out there may have heard of a crown or a cap, okay? So a cap is or a crown, same thing, like automobile and cars. Cap and crown are the same thing. That is a cap or a crown is a full covering to a tooth. We drill the tooth down on all its surfaces for various reasons. Lots of times it's due because we do this because the tooth is fractured or it broke or there was a ton of decay and we had to drill all of that decay out and basically destroy the tooth to prevent an abscess, to prevent the decay from going into the nerve. So very often we make a cap for a tooth in those situations. Well, a fixed bridge, a fixed partial denture, if you will, is when, let's say you have a missing tooth where my head is, and then there's a tooth here and a tooth here. Well, a fixed partial denture would involve putting a cap on this tooth and a cap on this tooth. So crown this tooth, and then connect those two crowns with a fake tooth in the middle called a pontic, okay? And basically we're talking about one unit that would cover the span of three teeth, a crown on this tooth, a crown on this tooth, and then we call those retainers. And then the middle tooth would, again, it's all connected, the fake tooth, middle, fake tooth in the middle called the pontic. And that would be replacing one tooth. Now you can make a longer bridge to replace two teeth, but generally speaking, most of the time, most bridges are probably going to be replacing one tooth. That's a fixed partial denture. It's not my number one go-to choice, but it's a decent option out there. It has some downfalls. For example, the biggest concept here is that you're making a one-tooth problem become a three-tooth problem. So what I mean by that is, hey, if an issue happens with this tooth or an issue happens with this tooth, the whole bridge is very often got to be replaced. Whether it be decay on one of these two teeth, or if we had some periodontal disease here and this anchor retainer tooth became a problem, then that compromises our whole bridge. So it's not without, it does have some downfalls, although it is definitely nicer than doing the removable partial denture option that I started the video off with. Now, this is going to lead me up to the third tooth replacement option, the dental implant. A lot of people have heard about dental implants over the recent years, and for good reason. They're a great tooth replacement option. They tend to be our best tooth replacement option just in terms of function, longevity, aesthetics, pretty much everything. The dental implant is the standard. This is another good reason that the implant is the standard is cost. So up front, the dental implant cost is a bit more expensive than the fixed partial denture, and definitely more expensive than the removable partial denture. But over the course of one's life, it's my opinion that the dental implant is less expensive, just given the fact that it's got the ability to so outperform and outlast the other tooth replacement options with better function, better aesthetics, and promoting a healthier dental condition. And what I mean by that is the dental implant allows the body to preserve its own bone wherever that tooth was lost. And there's some reasons for that, but it basically preserves the mouth, the oral cavity, the bone underneath the gingiva as best as we can preserve it. Way more, does a much better job than a fixed bridge or a removable partial denture. So yeah, now there's a lot of debate amongst dental professionals about, when do you recommend taking a tooth out and when do you recommend doing an implant? Is every tooth that, should we even do a root canal on a tooth? If someone's got a toothache, should we even root canal that tooth and try to save that tooth? And here's what I'm going to say. I think every situation is different. Every patient is different. Everybody's got their own different motivation. And my goal is to make sure that everybody understands, my patients understand the pros and the cons of each treatment that we're going to do, whether it be from the clinical aspect to the financial aspect and the longevity aspect, all the parameters and all the different things that go into each treatment option, all the different things to consider. I do believe that, generally speaking, the dental implant is the best clinically as well as financially over the long run. Now, that being said, a patient may say, you know what, I agree with you, but for now on, I just want to do this treatment. And that's fine. And in my practice, that's going to be fine. I'm never going to force anybody to go down any particular road. As long as I can do the treatment they want reliably, then that's fine with me. But it's my job to give my opinion as to what I think is the best and give them reasons and information as to why. That's all I want to say today. Everybody stay safe out there. I hope I didn't miss anything. I'll probably think about things that I didn't say in this video, but that's a general synopsis of the situation regarding tooth replacement. Everybody stay safe again. Like I said, Brian Hadeed, general dentist in Clinton Township, Michigan. Keep washing your hands and try not to lose any teeth. Bye.